Wear your mask, practice social distance, get vaccinated. We have had many conversations about protecting our physical health, but with the recent death of Regina King's son, we think it's very important, especially in the Black community, that we talk about protecting our mental health during this pandemic as well. Now, we've invited Dr. Chi, a good friend of ours, a hospital physician in Houston, to join us to start the conversation. Good to see you, Dr. Chi. Good morning to you. Let's talk about that, because we do talk about the physical issues that we face when it comes to COVID, but we don't talk a lot about the mental health issues and the impact that it has, this pandemic has on us mentally. What kind of issues do we face from a mental standpoint, especially now that we're out of the house again? Because obviously during the pandemic, when you were in quarantine, that had an effect on you. But right now that we're out and about, but this pandemic isn't over, what kind of mental effect is that having on people?
There's an array of mental issues that arise. Mental illness has been a problem for years. It just hasn't been discussed as often. And with the pandemic, it has created conditions in which we have recognized that mental health is important and it should be in the forefront. It started with social isolation in the beginning, and then you had people losing jobs, you had financial insecurities, and then you're going through grieving with people dying and suffering from COVID. And so it's just been a long haul of mental distress. And we forget that this is important. Like you mentioned, we talk about physical protection, we talk about vaccines, we talk about medications, all these things to fix your body, but we never talk about how to fix your brain. And we see these rates, especially in the Black community, of mental health being a problem. We're seeing that Black adults are complaining and really concerned about depression and having symptoms of anxiety more so than ever. And it's time that we shed light on it. And unfortunately, the recent death and suicide by Regina King's son really shine light that people are suffering, and we may not talk about it, but it's a real thing.
Yeah, obviously we don't know, and we probably will never know the reason why he committed suicide. We're thinking about Regina King and her family, of course, Ian Sr. as well, during this time of need. But there is an alarming rate of Black men increasingly turning to suicide when it comes to these issues. Do you have any idea why that is? Is it because of the pandemic? Is it because of what's going on in society?
If we think about the Black community, when we talk about mental health, that's something that we don't talk about often, especially in the Black community. It's usually a taboo type of conversation. As Black people, we're known to
Hmm.
be strong and we're known to withhold, information or just tough it out. But it's not really it's not possible for us to do that. We really need to talk about it. Black people, especially the ones in places that are, have low income, they're suffering, and we're faced with increased racism. There's financial insecurities, food insecurities, and of course we have low access of care. Those are all things that are difficult to achieve and to get access to. So you're going to keep seeing increased rates of suicide. Right now, Black youth has an increased rate higher than the white peers. We're seeing kids dying by
Hmm.
suicide, unfortunately, more than the white peers. And that's something that we don't know and we don't see because we don't talk about it. And you don't see it in the news either when we talk about the Black youth. So this is unfortunate situation, but I think this is a time we need to start shedding light on it.
Yeah, there are a lot of stressors, obviously, that affect us in our community. Which still comes to racism, still the fight for voting rights, obviously things that are going on, the pandemic, and we turn to a lot of coping mechanisms. A study led by researchers at Massachusetts General Hospital actually reveals excessive drinking increased 21% during the pandemic. So how does substance abuse ultimately affect one's liver and heart health and your mental health as well?
Many aspects. I've seen people coming into the hospital numerous occasions from drug overdose, more so than I had in the past during this pandemic. I've seen increased alcoholism, more so again during this pandemic. There's so many ways that drug abuse and alcohol affects the body, from the liver intoxication, it affects the heart, it affects the spleen. I can continue going from different organs, but The biggest concept
Hmm.
is that it affects overall health. And when your body is not well and your mental is not well, you won't do good long term. And it's something that is a problem. But unfortunately, this pandemic has exacerbated all of these. And sometimes we call it deaths of despair, or things that you turn to from drug, alcohol, and suicide that has increased over this time.
Hmm.
And it's something that I'm very passionate about, to make awareness, because we don't talk about it. And I'm willing to talk about it, and I'm willing to shed light on it and say that it's okay to get help. It's okay to seek help. And it's okay to reach out to people that, that can be by your side. And you need that support system, especially during this time. And there's no reason to be ashamed of it.
Yeah, I think we've seen that with some of the athletes who've come out and being very brave. And basically, there's a slogan now that's saying it's okay not to be okay, and it's also okay to speak up and say that you're not okay,
Mhm.
because there is help that is available out there. Help that is available out there. So we don't want to turn to alcohol. I think excess of anything besides positivity and money could be bad for a lot of people. So, what are some of the safe ways to deal or cope with the stress of the pandemic that's still affecting us?
My personal thing that I enjoy is family. I enjoy my family, whether
Mm,
that's from FaceTime, talking to them through video chat, just making sure you have close contact in some way with people that love you, people that you share a connection with, whether that's friends, whether that's relatives, coworkers, whoever you feel comfort with, because the stresses won't go away. Pandemic is not going away. So you have to find something, some support system that keeps you close and keeps you wanted. Sometimes people just need attention. Some people just want to ask, or just want that question being asked to them, how are you? And that changes
mm,
everything. Just a quick check in with people, I think, is very important to keep them aligned with reality and know that people care for you. People are there for you. Unfortunately, depression and anxiety shows different ways. Not everybody shows depression the same way. The common symptoms would be, losing lack of sleep and feeling depressed. But sometimes it
hmm.
could just be, you could be out in public and still feel alone. So that's why it's important to, look within yourself and ask yourself, are you okay? And that it's okay to reach out for help.
Yeah, yeah, once again, therapy is key. Maybe going to the gym. I see you
Mhm.
exercising a lot, former ball player, still got skills there. And yeah, of course, you're going to
A
reach
little
out to your
bit.
family because you come from a family full of physicians, so they got jobs and money. A lot of people, when their family reaches out to them, they're asking me for money. That adds to my stress. I'm just letting you know right now, I don't need the drama, don't add to my stress. So if you need some money, uh, might not be the right person to come talk to right now. I'm just saying. But, you can talk to Dr. Chi. She got it for you. Dr. Chi, we love you. We care about you. Once again, I don't know if you heard us talking at the beginning of the show, but we're very proud of you because we need more black and brown women and men of color out there in the medical profession, giving us what we need to know and what we need to hear, and not what we necessarily want to hear sometimes. So thank you for keeping it real with us, and thanks for always coming on and start your day with us. We appreciate you.
Thank you.